recording and the slides. So recording has started. Thank you, Alice. Okay. Let me know, Sophia, when should I start?
Sure, you can go ahead whenever you'd like.
Okay. So good morning, good afternoon, wherever you are, good evening, and welcome to this new, not webinar, but a dialogue organized by the Maternal Health Supplies Caucus under the Compass Initiative of the RHSC. My name is Milka Dinev. I'm your backstop at the Maternal Health Supplies Caucus, and I'll pass the baton to my colleague Safia Hassan, who is leading the Compass Initiative. And thank you, Martin Smith, our director, for being here today with us. So the mic's yours, Safia.
Great, thank you very much, Milka. Um, and as Milka said, my name is Sophia. I'm also with the Secretariat. I'm really happy to be on the line with you all today. Um, and just as a very brief introduction, so that our colleagues at USP can lead this call. Um, Earlier this year, the coalition, through our donor-funded Compass Initiative, commissioned a study to look at the regional manufacturing capacity and the corresponding market in Sub-Saharan Africa for a select group of maternal health supplies. US Pharmacopeia is doing work that they will detail in this presentation, so I won't get into that. But we're pleased with the way that the work is progressing, and we're looking forward to sharing it with you um, when it is complete, both through a report as well as at our general membership meeting. And I'm now happy to turn things over to Hooray, who is our technical lead at US Pharmacopeia for this work.
Yeah, good morning, everyone. Thank you, Safia, for the kind introduction. So my name is Peretoso. I'm the Director of Pharmaceutical Manufacturing Program at USP. So today, what I want to do is to just give a summary of the findings that of our findings for the landscape that we are doing in the Sub-Saharan Africa for some of the maternal health products. It's not an exhaustive summary. It is what I would call the summary of the raw data because we are currently busy analyzing the data further. But as you will see, we have found something that are really interesting that will be of interest to the folks on this call today. And as Safia has mentioned, it will be a dialogue. I hope that after the presentation, we can have some Q&A where I'll be able to answer some of your questions. Just a brief introduction about USP. Some of you know about our organization. It is a 200 years old organization. We are known for our standard settings in the industry for therapeutics, vaccines, and food, and even medical devices. That is the core of our business. But over the last 5 to 6 decades, we also got into the global health where we help manufacturers and countries to improve the quality of the health products in those countries. And this is done through capacity building with the regulators and also with the manufacturers. And the end goal of all of this is to ensure that there is equitable access to quality medical product everywhere. And especially in the LMICs, we have a lot of programs that we run in Africa, Asia, and the flagship program that we have is PQM Plus. And this kind of gives us a good understanding already of what the landscape of the manufacturing looks like on the continent. So when we embark on this road, or in this study, we already knew what to expect and who to talk to, which had given us a little bit of mileage before we start this work. So About a year ago, Safia reached out to us to be able to, with a question, pretty much, how can we understand the impact of COVID on the supply of some products on the continent? And second, what does the supply looks like, and what can be done to increase the supply of quality product on some of those in the region, in the Sub-Saharan region? And when we start thinking about this, there's a lot of stuff that we discuss. But in the end, one of the things that I want to highlight through our discussion that came clear is that if you want to increase supply of quality product, it has to be strategic, and it has to be based on the market demand. And to be able to understand that, we need to do a study to understand what the supply currently looks like on the continent. That is why we decided to do a landscape analysis. And the landscape analysis is to understand the bottleneck that currently exists, preventing the supply of quality product on the continent, and what can be done to strengthen the supply by building a more reliable, sustainable production on the continent. To strengthen the supply chain, one of the strategy you can use is through diversification. And to diversify, you want to understand what is currently being produced on the continent. That's why we embark on this journey earlier this year to conduct a landscape analysis on the continent. And we decide to look at 5 products based on what the coalition, based on the mandate that the coalition gave us. The 5 products were oxytocin, magnesium sulphate, histable carbetocin, misoprostol, and tranexamic acid. And in our scope, there were 5 questions that we were trying, no, 6 questions that we're trying to answer. And I'm listing them here, and I'll just highlight some of the key ones. One is to identify all the manufacturers of this product in the Sub-Saharan region of Africa, and then understand what are the capacity, what are the capability, what does the QA system looks like, and who are the major procurers or customers, if you will. Pretty much in the end, understand what the demand is so that we can know what are the gaps and challenges to increase supply from those companies so that they can meet the demand in that region of Africa. So overall, that is what our scope looks like. And those are some of the questions that we try to answer over the last 5 months, 5 to 6 months. So trying to understand the manufacturing landscape of in Africa pretty much is trying to sweep these 600 manufacturers that we have on the continent. About 2 years ago, a nice research was done to map out all the manufacturers in Africa, and this is what it looks like. And you can see that there are some countries where you have a strong base of manufacturing. And when you look at the concentration of manufacturing is driven mostly by 3 factors, the legacy of past industrialization. This is the case, for instance, in Nigeria and South Africa, for instance. It's also driven by the national trade and industrial policy. This is the case like in a country like Ghana, for instance. And also, what does the strong local demand looks like? So when we're trying to understand who are the manufacturers of those 5 products, our goal is to sweep all of these companies, but we decide to focus on some countries instead of doing the sweep of all the countries in the Sub-Saharan Africa for various reasons. But we chose some countries based on 3 main metrics. The first one is the regulatory maturity level of the countries. And this is driven precisely by the fact that countries with a higher maturity level, and currently the highest in the continent is 3, are countries where you have a stronger manufacturing base. And currently you have four in the sub-Saharan part of Africa. You have Nigeria, Ghana, Tanzania, and South Africa. We also decide to include in the list as well countries where you have a higher number or proportion of manufacturers. That led us to include countries like Kenya and Ethiopia as well. Even if Ethiopia has only 4, we included them because of the strong market demand. And lastly, we decided to add to that list countries where we have at least one product that has been WHO pre-qualified. And in that case, you have Nigeria, for instance, but then you also have Zimbabwe, which has only 3 manufacturers, but in that country, you have one that has one of the product for HIV, WHO pre-qualified. And we decided to include all of those because we believe that if there is any manufacturers of any of these products in Africa, it has to be out of those countries. It has to be out of one of those companies. And also some of those companies are companies that we know are making effort to improve the quality system. So overall, we chose 10 countries, but we decided to focus later on 9 because Senegal, after due diligence, we realized that there's not much that we can glean out of that. So we focus on the 9 remaining, meaning Ghana, Nigeria, Ethiopia, Kenya, Uganda, Tanzania, Zimbabwe, and South Africa. So one of the first things that we did is to understand what is the availability of this product in these countries. And we look at a lot of data and we collected a lot of information. And some of the information that we collected in these countries are, for instance, the product that is available in those countries. Second, the dosage form available, the strength, who are the supplier, who are the manufacturers, the country of manufacturing of this product. And this is here a summary of what we have found so far. A quick highlight, for instance, which is not a big surprise to many just yet, is that carbetocin is only available, but slightly in Ethiopia, Kenya, Tanzania, and Uganda. We didn't see that in any other countries. One thing that we also saw that is interesting is that you have some dosage and strength of some products that are available across all the countries. But in some cases, that's not the case. There are some strength or dosage forms that are present in some countries, but not in others. This is really important because if you want to increase the supply through local manufacturing. Sorry, is somebody asking a question? Okay.
No, don't worry. I just muted them. When people open inadvertently their mics, I mute them. Sorry.
Okay. Thank you. So this is important, as I was saying, because if you have a manufacturer making a product that is registered in all the other countries, it makes that supply much easier. So if someone wants to make an investment, for instance, to increase a supply or a targeted, I think this chart can give you a glimpse of where you should focus that that investment. But in our report, you will see a more bigger chart or table. We are deciding how we're going to present all of this, but that captured all the strength available. I can tell you that depending on the product, there are some countries where you have a strength or dosage form that is not available in other countries. Interesting data. And some dosage form, for instance, for tranexamic acid, are present in some countries but not in others. It was kind of interesting to see, and I hope that in our report you will see all of those. But more importantly, what this helps us to do is to also understand the country of origin of the product, and it's also helped us to quickly to identify countries in Africa where some of these products are made and at which strength or dosage form, which will take me to the next slide. What we found was really interesting. On the continent, we found only 4 countries where you have manufacturing of this product. You have Nigeria, South Africa, Kenya, and Ethiopia. And as you can see on this map, you have 3 manufacturers in Nigeria making misoprostol, oxytocin, and magnesium sulphate. And I have to say that it's only 2 manufacturers. One is making misoprostol, the other one is making oxytocin and magnesium sulphate. In Ethiopia, we have 1 manufacturer making magnesium sulphate. In Kenya, we have 2 manufacturers. One is making magnesium sulphate. There is a new player in the scene in Kenya, and they already finished the process development, and I think they will start commercializing tranexamic acid soon. And there will be the only company in Africa making tranexamic acid. In South Africa, we found 2 manufacturers, actually, one for magnesium sulfate and another one for tranexamic acid. However, the one who was making the tranexamic acid discontinued the production because I think 3 to 4 years ago, they lost the tender for that product in South Africa, and they didn't have any market. And because of that, they had to discontinue that line. We spoke to them and asked them if they were interested to resume production, but for them, unless they see a demand, they will not do so. So overall, that is what we saw the landscape in Africa looks like when it comes to these 5 products. There is no manufacturer of carbetocin that we have seen. And interestingly, in all these countries, you have at least 1 manufacturer making magnesium sulfate. So what we did after that is that we approached all these 6 manufacturers and we conducted a survey where we tried to collect some information from them. I'm happy to report that out of the 6, 5 have responded to our survey and gave us all the information that we desire to have, giving us an impressive 83% response rate. When you do stuff like this, sometimes you'll be lucky if you have 50%. So even though our N is small, we are happy that we have 5 responding. The only company that didn't respond is the one based in South Africa, and we push as much as we can. But for me personally, the cutoff date is Friday. If we don't get anything from them, we just continue with our report and we will exclude them from our report. But at least we have a clear picture of what other companies are making or are doing. One other thing that we was able to do is, and this was part of our scope of work, was to identify potential manufacturers on the continent. Initially, we thought that one way we want to do that is to look at companies that we know of or we have some information of based on some of the data, some of our own database that we know have the capacity to make this product. When we start looking at those, we quickly came up with about 20 companies. And when we start analyzing some of them, and I was trying to come up with some criteria of selecting who will be best positioned to do this, and also understanding that the need for the coalition is to understand what are the companies that are able to quickly bring something on the line if they need support. I decided to shift our strategy a little bit from that, but to focus more on companies that have current plan to make some of these products. So the team did a great work, and what we found was that we have 5 companies, I think 3 in Nigeria and 2 in Ghana, who have active plan to start making some of these products. And the only product that is not on the list currently is carbetocin, but otherwise the other 4, these 5 companies in Nigeria and Ghana have active plan. They have the product developed already. Facilities are being built to make some of these products. So we decide to focus on some of those countries and that have near-term plans to start making, and we are currently finalizing surveying them. I don't have a response rate for you to report just at the moment, but we are confident that it will be close to what we have for the current manufacturer, if not 100%. So what are the information that we are collecting from this manufacturer? Number one, we are trying to understand the capacity of production of this product. And for the current manufacturers, we have those information. For the ones that I'm calling the future manufacturers, we are trying to understand the planned capacity, and hopefully we have that data as well. We try to understand whatever gap they have in the regulatory compliance or QA system. If they want to have plan to get the product WHO pre-qualified, we try to understand those as well. And lastly, another set of data that we try to understand are the barriers or market dynamics that impact the manufacturer of this product, so that we can formulate some recommendation to you all, so that if you want to make some investment, you know where to make some of those investments. So those are the summary of some of the data that we have collected and will be analyzing fairly soon. I see a question in the chat. Is any manufacturer about to make 25? I cannot say yes off the top of my head. I had to go back and look at the data. And if that is the case, I'm sure that it will be in the report, but I can look at it specifically and get back to you, Debbie, on your question. I will continue. So the next set of data that we try to collect is on the demand side, because we want to understand what the gap is when it comes to the supply. And this is where we have the most challenge. Because of the way the procurement work in some of those countries, it's kind of very challenging to clearly map out what the demand is like. Time will fail me to talk about different strategies that we try to put together, but in the end, what we decide to do is, number one, focus on some countries where we know we can have some, number one, countries where we know we have manufacturers of a product. So meaning Kenya, Ethiopia, South Africa, Nigeria, and also Ghana, because we know that we have companies trying to bring some production in the line. And we want to understand what the public demand is or looks like. So I'm happy to report that at least when it comes to Kenya, Ethiopia, and South Africa, we have a complete set of data to understand that. But we also know that some of the product has a different indication, and some of them are channeled through the private sector. So we were able to get also some import data to be able to capture what are, maybe there may be some data that some of the demand that we didn't capture in the public sector, from the public sector. We are hoping that the overlap from the import data will help us to know what is going to the private side. So at least in some of those countries, we have data to understand what the demand looks like. Where we have what currently is for us a black box, where we don't have a lot of visibility, is the demand or the procurement from the international major organization, especially when it comes to on the donor side. That's where we have struggled to have any meaningful data. We don't have that much. That will give me a great confidence to include in the report at this moment. I will request for the folks on this call, if you have some of this information you can share with us, that would be very helpful. What that will help us to do is to determine what the overall demand is like, and that will help us to conduct a gap analysis and make some recommendation on what needs to be done on the local production side to meet the local demand at minimum, or at least what can be done to strengthen the supply chain when it comes to, through the diversification of the supply. And this is really important. And this can also help some of the manufacturers to make a business case, because some of them are telling us that to be able to expand their production, being able to have a better visibility on the market will help them. So we suspect that this report also will be beneficial to them as well. What are our challenges that we face throughout this work? The main one is on the data acquisition. And when we before we start this work, that's one thing that we discussed with Safia and her team, that is not easy to get some of this data. But there are a few that I want to flag, and mainly the first one, which is some of the inconsistency that you see on the register from the national regulatory agencies. Some of the data are not consistent, and you need to have a trained eye you need to have trained eyes to be able to know exactly what you're looking for. But with our team and also with some of the relationship that we have built with some of these agencies and companies over the years, we're able to get the data that we need to produce a meaningful report. I see. I will answer some of these two questions after I finish on this next point. So what our next step? So we finished with the desk review. We almost done with our data collection. Now we are busy analyzing the data, and in the process, we may go back to get more data to complete our report. And we have started drafting our report. No, we will start drafting the report sometime next week, and that report will come out sometime in September. And that will conclude my presentation. Thank you so much. I know I have two questions in the chat. I'm going to answer those two questions before I open the floor for the rest of the audience. Milka is asking for countries that have imported oh yes, we do have that information, Mika. And so on that front, we have two sets of data. Some of the one that we collected initially on the supply side, and for the import data, also we also get some information on the origin of those products. So what we have seen is at least consistency between the import data and some of the initial data that we got on the supply side. So we were able to get some of those information, and I hope that answered your question. The last question is an interesting one. Yes, there is a lot of data sources that we use to be able to get the import data. You can get them from various sources, including the regulatory agencies, but also from some of it varies from country to country. In some countries, it has to be from the port authorities, but it is a lot of work that needs to be done to determine where you need to go to get this information from. But we were able to get those, and we are very confident. And sometimes when you get this information, it is a massive data that you get, and you need to be able to extract your information out of those. And we are actually busy doing some of those and to correlate our data. Thank you.
Thank you, Pereira, for your presentation. And we have some hands up. Safia, you want to moderate the question and answer? We have Kate Rademacher.
Sure. Thank you, Milka. And yes, Kate, I saw that your hand has been up for a while.
Yeah, thanks. Can you hear me, Safia?
Yes.
Great. Thank you so much for this incredible presentation, sir. Really impressive. And as you said, it's very difficult to get this data sometimes. So I really applaud you and thank you for summarizing it so clearly, what a valuable addition to the field. So I'm really excited about this. And I apologize, but had a bit of difficulty connecting. So came in about 5 or 6 minutes late. So you may have said this, but obviously, you focused on maternal supplies, but there's been quite a bit of interest in potential for manufacturing capacity for contraceptives in sub-Saharan Africa too, which I know is a big step up from the products we're talking about if we're talking about hormonal methods. So I'm just wondering, and again, apologies if you said this and I missed this, but have you looked into that at all of potential capacity or appetite to expand production into new therapeutic areas, particularly if they're difficult and involve hormones? Thank you. Over.
Yeah, thank you for your question. The simple answer is that no, because when we were doing this work, we had a clear mandate to focus on some of PPT. Yeah, we had a clear mandate to focus on some of those 5 products, but if that is of interest, it is something that we can take a look at in the future. I know, I think we were in a forum where some of this work was mentioned, and somebody asked the same question. So it is something that we can come back and revisit. But at least for the moment, we didn't collect any of those data. But we have had some interaction with some manufacturers who have interest or who are making some of those products. But try to have a deeper dive into those. We have not done that just yet.
Thank you. And I see that we have another couple of hands up. Ademola.
Thank you very much, Sophia, and thanks a lot there. Excellent job and congratulations to the team. My name is Ademola from United, and I think it's just very good to see, because we've also been doing some scoping along these lines and the results are very consistent. I know we've spoken a few times and it's so great to then see this get into this point. Just a quick comment on the demand side work, and I'm sure you're aware that our team that we're supporting on the Amplify project is looking at that. And I just hope that we would be at a point where some early results also from that project would be able to contribute to this work, especially being able to map the demand and the supply side. And also at Unity, we're looking actively internally and with some of our donor partners to figure out what next from here, because I think that's the most important thing. What next in terms of quality assurance status? What next in terms of how we are able to ensure that we get cost competitive products from the continent? So I think it's just exciting, and it's great to see that you've made this very big step, and big thanks to the RH Suppliers Coalition and everyone that has worked on this. Thank you.
Yeah, thank you so much, Ademola, and good to hear from you. And indeed, one of the good things is when we started this work, Sophia and link us with the team working on the demand side funded by United. And we have had some good discussion, and especially try to compare our methodologies when it comes to demand, so that we know that we are in line in this work. And we do have some regular checking with each other, and we understand that we understand the challenge they face. They also understand some of the challenge that we face as well. But one thing that I'm kind of confident about is the scope is a little bit bigger on the demand side compared to ours. And in the end, the report will nicely complement the work that we will have done. So I'm really excited about that. And I'm looking forward also to the report as well, because I think it will nicely, as I said, complement the work that we have done, both on the supply and some of the demand that we have, work we have done. I see also another question on the chat from Tame or Tama. Sorry if I mispronounce your name. Yes, so we asked some question about no, not ask a question. We try to evaluate the quality of the commodity that we are assessing, and of course, we are not going to ask them like, what is the quality of your product? We have some indicators that we have and we ask some questions around some of those indicators, and the answer that they give us clearly help us to understand where they are when it comes to the quality of the product. So we are currently analyzing some of those data, and I think that when the report comes out and you read it, you will have a good answer about that question. And I will say that for that reason specifically, we will mask the names of the company, because we don't want to be prejudicial to any company. So that answer specifically will be a little bit nuanced, but it won't name any company. The companies will be masked, but overall, you will have a clear sense of the quality of those products on the continent. And also potentially what intervention needs to take place to take them to WHO pre-qualification, for instance, if needed, right? So we will provide all of those information in our report.
Pereira, sorry to interrupt you, but if you stop presenting, we can probably
Okay.
have people join, and this would look more like a dialogue.
Oh, sorry. Okay, thank you.
No, it's nice. No, that would be
Yeah.
nice because some people have their cameras on, and it
Okay.
looks more like a dialogue, and you're accompanied by all of
Thank you.
us. I wanted
Appreciate that.
to make a comment on Ademola's comments. When and if Unitate finishes their studies on the demand side and that, please do reach out to the Maternal Health Supplies Caucus. We would be very appreciative of presenting your work and discussing your work in this forum. We have members from all over the world, so it might be helpful for you in the future. So please do use us as a dissemination vehicle. Thank you.
And we do have a couple of hands up. Andrew has had his hand up for quite some time. Sorry for the delay, Andrew.
Hi there. Yeah, no problem at all. Yeah, come on, camera. So first of all, fantastic presentation. Thank you so much for presenting to this group. I think the question I really had was really, well, I think we all know that the economics surrounding local manufacturing, especially of maternal health supplies, is really challenging. And I think you alluded to that in the presentation when you're talking about that South African supplier that's now dropped out of the markets and because the sales aren't there. And you know, we keep seeing this as a kind of a trap here. On the one hand, you know, locally produced maternal health products are often not the cheapest products available on the market. You know, they're unable to take advantage of the economies of scales that the suppliers from India or China or whatnot are able to access. And most of the buyers of MNH products, you know, are the governments themselves. You know, unlike in other health fields, you know, it's actually the government of certain countries who are paying this. And we all know they're under severe budget constraints, always kind of having to, being forced to go for the cheapest possible supplier. And then on the other side, when you talk about the donors and donor procurement, of course, they have to buy from quality assured suppliers, WHO pre-qualified suppliers in particular. And to reach that status, especially as for anyone, requires a huge degree of investment, and that obviously increases your costs and increases your price accordingly. And so, we see this, there's been this market trap for a long time, a very long time, just when it comes to maternal health products for local manufacturing, which I don't think we've been really able to break through as a community, as a group. And so my question really is, there's a question, which is, on the demand side, when you're looking at that, have you seen, any indication that something will change? That there's interest from the buyers, be it the governments, to pay a price premium for a locally produced product, which might be more expensive than the oxytocin coming from somewhere else, or for donors who are willing again to pay more for locally produced products and provide some kind of incentive or assurance that it's worthwhile for the supplier to invest in their systems, really make a massive cost commitment, but they'll get that back in the future. Because I think if we don't get to that point, honestly, this is not going to go anywhere, because we need to break out of those bonds that we're seeing at the moment.
Yeah, I mean, one good thing is that this is not happening in a silo, right? It's happening in a context where you have a renewed conversation around local manufacturing. And I think we are in an environment, especially post-COVID, where various stakeholders, government, donors, and everyone understand that diversification of supply is essential, right, to strengthen the supply chain. And we are now hearing, and steps are being taken by all of those stakeholders to put in place strategies or policies, right, to be able to, if you want, jumpstart, right, the local manufacturing on the continent. There is a lot of donors who are doing the same. Many governments on the continents are doing something similar. And you are also hearing, and I have been part of conversations where donors and organizations and donors and governments are also now understanding and saying that they understand that at least at the beginning, they may be willing or no, maybe forced to pay a premium to support the local manufacturing. So I think post-COVID, the landscape has shifted dramatically on the continent. The challenge is how do we support the manufacturer to meet some of those requirements to be able to do that? Now, to your question, the market shaping work that needs to be done was not part of the scope of our work, but is part of the scope of the work that United is doing with PATH and JPIGO. And I'm in close communication with the team doing that, and they're doing something really important here. I understand that it's not across all the 5 products, but it's 3 of the 5 that we are looking at. But they are doing that work of market shaping that I believe is really, really essential, because in our study, we also discovered that that needs to take place to strengthen the hand of the manufacturer to be able to make a business case to make a more significant investment. Now, you talk about WHO pre-qualification, for instance, that will allow donor to procure. It is a need. The manufacturers, I can tell you that they told us that they need the support to do that. We are willing to support them, but it requires an investment from an organization to support us to do that. So all of those things need to take place to allow the market to be where it needs to be. But it's good that we know that the change in policies that need to happen to support the market, at least those discussions are taking place. Some actions are being taken as we're speaking, and we also hope that some member of this audience will also make the investment that these manufacturers need, right? Because to be frank, some of them have a lot of financial stress, right? Because they're already working in an environment where financing is really hard, high interest rate, all of that. So if you ask them to make further investment, for instance, to be WHO pre-qualified, it will be a lot for them. Some of them are willing to do that. Granted that the market is there, but having any support will be able to help them. But some of these things will transpire in our report when that comes out. But yes, those are some of the things that we're looking at. But the market shaping side, I'm glad to see United doing that with PATH, and I think that would be very complementary, as I said, to this work as well. I hope that answers your question.
It does. Thank you.
Thank you. Mm-hmm.
Great. And we have another hand up from Denise. Denise, please go ahead.
Hi, thank you so much for this presentation. It's really well done. I just want to reiterate Kate's question about exploring sub-Saharan African manufacturing for contraceptives, particularly hormonal contraceptives. That's a real interest. Would love to hear, if that goes through. And then I just wanted to build on the discussion of demand. Can you say anything about the demand in the private sector? Because you really highlighted demand by governments and donors, but you didn't say much about the private sector. Perhaps because of the nature of the products, this isn't as big of a demand, but anything that you could say would be helpful. Thank you so much. And again, congratulations on the presentation.
Okay, thank you so much. Yeah, on the contraceptive side, I think, again, maybe I have a conversation with Safia after this to see what we can do in the future about that. But on the private side, it is really, really challenging. This is not the first time we did a demand assessment on the continent, especially for some of these commodities. And it is really challenging to be able to understand what the private is procuring. But we hope that some of the import data that we have can help us to answer that question. I'm not at the moment, we are busy analyzing the data, and I don't have the latest report just yet, so I cannot confidently say that I'm happy with where we are on the private side. For For some of the product, I can say that is really negligible, but some of them is more meaningful. But I need to look at all the data to be able to say something. But it is something that we are looking at and we have looked at, and you know, once the report comes out, I think we will have answer to that question. If for some product we see that it's not meaningful, we will not include that. But where we see a good data that we feel like is meaningful, we will include that in our report as well. Thank you.
And Pere, we have quite a few questions being entered into the chat. Firstly, someone is asking, I'm curious to hear what criteria you used to identify potential manufacturers that could get a product to the market quickly beyond their indicated interest in making these products.
So that is a very interesting question, and it's a very difficult one. So you can ask you can answer the question from the technical point of view, but also from the business point of view. But for this case, you have to do both technical and business. So first of all, on the technical side, we know that some of these products are sterile injectable, the formulation that are used. And one of the things, for instance, that we want to understand is what are the companies that have such capability currently on the continent. And we were able to narrow those down. And there are other criteria on the technical side based on some of the data that we have, right? Because we have done a lot of analysis on the content where we have a lot of data about most of these manufacturers. We understand the capacity, the utilization rate. We understand some of where some of them stand on the quality side. So we put in place a set of criteria, and I think we came up with about 12 that we used to screen the 600, not 600, the 400 manufacturers in the Sub-Saharan Africa. But in the end, we decided not to use that at all. And the main reason is because based on the question that has already been asked, right? If the manufacturer cannot make a business case to make that product, it doesn't matter if they have the technical capability. If the business is not there for them, forget it, they will not do that, right? So that's why we decided to focus on manufacturers who we know maybe have made the business case for themselves and are currently making the plan to make those products. So out of the list of 20 or so that we identified, we actively spoke to each of those companies, and that's how we came up with some of those 5 in Nigeria and Ghana that currently have active plan to make those products. So you have to marry the technical and the business for stuff like this. Otherwise, you can have companies that have the technical, like the one in South Africa, they have the capacity to supply the whole continent, to be frank. But the business is not there. So in the end, that's what drove us to focus more on that side. And now we are just trying to understand from them what are the needs, where are they coming in line, and few other stuff that we think will enhance the report and inform more the reader of the report. I hope that answers your question.
And thank you, Pere. And the next question is regarding the import data. Sangeeta asks, since it's difficult to get import data from a national regulatory authority, is it more feasible to conduct such a study if we conduct it in collaboration with NRA engagement so that the data will be more reliable?
Yes, that's what we did. So that's one of the things that took us time, right? Because we eventually collaborated with the national regulatory agencies to get some of those data. We wrote letters to them directly, and it was very helpful that USP, having worked in some of these countries and actively working with some of these national regulatory agencies, actually all of them, it helped us to get some of those data. But there have to be some due diligence that they have to do on the side to supply us with those data. So that's what we did, and we were able to get the data that we need. It was not something that we just gleaned out of somewhere, but it was data that the national regulatory agencies gave us, and it was in collaboration with them, and we did an extensive engagement. There was one country that will remain nameless, where that engagement, even though we have been working with them for, I don't know, 5 years plus, it took us more than 3 months before we get the data that we need. So it tells you the level of, and in all of those cases, I have to write letters signed by me before the final data can be released. So we did those with them, and we explained to them why we need some of this data, because it's sensitive, and they understood all of that. And with the trust that we have established as an organization with some of those national regulatory agencies, we were able to have access to those data. That's why we are pretty confident about the data that we have on the supply side.
And we have another question. Christina asks, does the data include contract manufactured items from India or China, which are then imported and released to the market by manufacturers in Sub-Saharan Africa?
That is a really good question. That is a really good question, but it's really challenging to know that because of, for the lack of better term, the mechanism and games that is played around that specific fact. So we were not able to fully capture that. But if there is a country where that is more prominent, it will be in South Africa. And that is where we spend most of the time trying to sweep and to understand what is going on there. I can say that that question is one of the last information I asked the team to check. And I think I will have the report from the team on Friday. If anything comes out of that, we will know. I will know by Friday, but as of yet, I have not seen that. That plus other information that I want to cross-check in South Africa. But that would be where I think that will be happening the most. You may have that in Uganda, but we checked that, but we didn't see that over there. But South Africa is where we have not finished looking at. And if that is there, it will rely mostly on some of the relationship that we have built over the years, and some insight that some of the industry insiders can provide to us, and we are busy doing that. So hopefully we can have those as well by Friday. If there's nothing there, it may not go into the report at all. But yes, we are conscious of that, and we are looking into that as well.
Great. And it looks like Sangeeta raised her hand recently. Sangeeta?
Hello everyone, thank you for the very good presentation. So my concern is that the 5 products are there. So among that 4 products is injectable. And among that also 2 product like it's a steroidable injectable. So the country, like most of the developing country, especially in that region as well, like they may not have the injectable plant capacity, because they manufacture solid tablet capsule they may be having. The reason behind is that injectable plants, like it demands a high financial requirement. So like what recommendation can we go, like each country, in if their population is not high, that means demand may not be high. So can each country have their own injectable plant for steroidal manufacturing, and will it be sustainable for them to have that plant? Because this business and this should go along with each other. So that is my concern, because in developing country this is a issue why we don't have availability of this product. So since these are injectable, so that first of all is a very difficult thing, because those type of plants, they are very high cost. And another steroidal injectable, like you need to have a separate than injectable plant as well. So
Yeah.
again, you need to have a different facility. So all these things demand a high cost. And so what is the demand of the medicine that they have? So what is the sustainability? So that is my concern and query. So thank you.
Yeah, thank you for your question. the fact is that the landscape is shifting a little bit. So first of all, I think we found 2 companies that have injectable lines on the continent. And I think you see that in the report, you have 2. And then we also have 2 who are planning to set up or are setting up currently injectable lines, still injectable lines on the continent. But yeah, so I think the business is driving this, right? But then to your larger point, we are not advocating, and I think I will advocate against every country setting up their own lines, no matter what the product is, even for some oral solid dose. I think it makes sense to think about regional manufacturing, where, I mean, the issue that we are, or the problem that we are trying to solve is the problem of supply security, right? So if you have a manufacturer in a region that can supply to a region, I think that should be sufficient to supply to a whole region. So not every country will be setting up their own line. That's not what we say in our recommendation. Our recommendation will advocate for regional manufacturing, but I get your point about the steroid injectable issue, but companies are already setting that up. There's also not for this product, but there is also a discussion I was having with another organization recently that is interesting in supporting the production of a steroid injectable, and we're looking at what are the capacity. One thing that is kind of really interesting is that at the height of COVID, you have a lot of projects to set up some fill finish lines on the continent, and some of those lines will not be used. The question is, can some of those lines be repurposed for some of the steroid injectable lines? I think that is something that we are looking at, that we are thinking, helping folks to think through. And I think that may be a solution in a case that all of those lines are not used. I will stop there, and I hope I answer your question.
Thank
and
you
I know
very
we have
much.
time too. Yeah.
Yes, and I think that you've answered all of the questions that were in the chat. And thank you so much for a fantastic presentation, and also for your thoughtful answers to the questions that were posed. This has been great. I'll hand off to Milka for closing.
Thank you. Thank you, Pereira, again. Thank you, USB, for a wonderful presentation. You have really opened a huge discussion. And thank you, everybody, for your attendance today, for being on time. Our next meeting will be August 15, and we will be discussing the content of the LEAP report. So I really encourage all of you to attend, because the LEAP report is about gaps in funding. So our input to how we want to use that data is going to be crucial. So thank you again. Thank you, Pereira, USB, and thank you, Safia, for doing this. If you have any questions, if you have any more comments that you were not able to put in today, please let us know. Write me an email. We will get back to you immediately. A copy of the presentation and the recording of this meeting will be shared with the whole caucus. Thanks again, Pereira, Safia, until the next time.
Thank you so much. Okay, bye-bye.
Bye-bye.
Yeah.
Bye.
Bye.
Thanks. Bye all.